Pathophysiology. Heart failure can occur due to impaired ventricular function, leading to decreased cardiac output and inadequate tissue perfusion. This can result from conditions like myocardial infarction, hypertension, or cardiomyopathy. Types of heart failure. Heart failure can be classified as systolic or diastolic, depending on whether the heart's ability to contract, systolic function, or relax, diastolic function, is impaired. It can also be categorized as left-sided or right-sided, depending on which side of the heart is affected. Signs and symptoms. Common signs and symptoms of heart failure include dyspnea, especially on exertion, fatigue, orthopnea, difficulty breathing when lying flat, paroxysmal nocturnal dyspnea, sudden awakening from sleep with shortness of breath, peripheral edema, swelling in the legs or abdomen, and decreased exercise tolerance. Diagnostic tests. Diagnosis of heart failure often involves a combination of clinical assessment, imaging studies, such as echocardiography, laboratory tests including B-type natriuretic peptide, or BNP, and sometimes invasive procedures like cardiac catheterization. Treatment options. Treatment for heart failure aims to alleviate symptoms, improve quality of life, and reduce the risk of complications. This typically involves a combination of medications such as ACE inhibitors, beta blockers, diuretics, and aldosterone antagonists. Lifestyle modifications such as sodium restriction, fluid restriction, and regular exercise are also important. In severe cases, interventions like cardiac resynchronization therapy, CRT, implantable cardioverter defibrillators, ICDs, or heart transplantation may be necessary. Patient education. Patient education is essential in managing heart failure. Patients should understand the importance of medication adherence, dietary modifications, symptom monitoring, and when to seek medical attention for worsening symptoms. Question 1. Which of the following is a common symptom of heart failure? A. Bradycardia, hypertension, dyspnea, hyperglycemia. Answer C. Dyspnea. Rationale. Dyspnea, or shortness of breath, is a hallmark symptom of heart failure, especially on exertion. It occurs due to inadequate cardiac output leading to pulmonary congestion and impaired gas exchange. Question 2. A patient with heart failure is prescribed furosemide. What is the primary purpose of this medication? A. Lowering blood pressure. E. Improving cardiac contractility. Reducing fluid volume. Preventing blood clot formation. Rationale. Furosemide is a loop diuretic used to reduce fluid volume by promoting diuresis and sodium excretion, which helps alleviate symptoms of congestion in heart failure patients. Question 3. Which diagnostic test is often used to assess the severity and etiology of heart failure? A. Electrocardiogram, ECG. B. Chest X-ray, echocardiography, complete blood count, CBC. Answer C. Echocardiography. Rationale. Echocardiography is a non-invasive imaging test used to assess cardiac structure and function, helping diagnose heart failure, determine its severity, and identify underlying etiology. Question 4. A patient with heart failure reports sudden awakening from sleep with shortness of breath. What term is used to describe this symptom? A. Orthopnea, paroxysmal nocturnal dyspnea, dyspnea on exertion, tachypnea. Answer B. Paroxysmal nocturnal dyspnea. Rationale. Paroxysmal nocturnal dyspnea is characterized by sudden awakening from sleep with severe shortness of breath, often relieved by sitting upright, and is indicative of worsening heart failure. Question 5. Which lifestyle modification is typically recommended for patients with heart failure to reduce symptoms and improve outcomes? A. High sodium diet. B. Fluid intake without restriction. C. Sedentary lifestyle. Regular exercise regimen. Answer D. Regular exercise regimen. Rationale. Regular exercise within the patient's tolerance is recommended for heart failure patients to improve exercise capacity, muscle strength, and overall quality of life. Question 6. What type of heart failure is characterized by impaired relaxation of the ventricles during diastole? A. Systolic heart failure, diastolic heart failure, left-sided heart failure, right-sided heart failure. Answer: B. Diastolic heart failure. Rationale: diastolic heart failure is characterized by impaired ventricular relaxation or filling during diastole, leading to preserved ejection fraction and symptoms of heart failure. Question 7. Which medication class is commonly prescribed to improve symptoms and outcomes in patients with heart failure with reduced ejection fraction, H4F? A. Angiotensin II receptor blockers, ARBs. B. Calcium channel blockers. C. Statins. D. Beta blockers. Answer: D. Beta blockers. Rationale: beta blockers are recommended in patients with heart failure with reduced ejection fraction, HIFrEF, to reduce morbidity and mortality by blocking the harmful effects of sympathetic nervous system activation. Question 8. Which device is indicated for patients with heart failure to improve cardiac function by synchronizing ventricular contractions? C. Cardiac resynchronization therapy, CRT device. Pacemaker. B. Implantable cardioverter defibrillator, ICDC. Cardiac resynchronization therapy, CRT device, left ventricular assist device, LVAD. Answer: C. Cardiac resynchronization therapy, CRT device. Rationale: CRT devices are indicated for patients with heart failure, particularly those with ventricular dyssynchrony, to improve cardiac function by synchronizing ventricular contractions and optimizing cardiac output. Question 9. A patient with heart failure presents with peripheral edema and abdominal distension. Which side of the heart is most likely affected? A. Left side. B. Right side. C. Both sides equally. None of the above. Answer: B. Right side. Rationale: peripheral edema and abdominal distension are characteristic signs of right-sided heart failure, where the right ventricle fails to effectively pump blood to the lungs, leading to systemic congestion. Question 10. What laboratory test is often elevated in patients with heart failure and can be used for diagnosis and monitoring of the condition? A. Troponin. C. Reactive protein, CRP. Brain natriuretic peptide, BNPD. D. Dimer. Answer: C. Brain natriuretic peptide, BNP. Rationale: brain natriuretic peptide, BNP levels are frequently elevated in patients with heart failure due to myocardial stretch and can be useful for diagnosis, prognosis, and monitoring of the condition.